Welcome back to See, Hear, Feel. I have the pleasure of speaking with Dr. Antoine Bechara. Dr. Antoine Bechara is a professor of psychology and neuroscience at the University of Southern California. Dr. Bechara received his doctorate from the University of Toronto and completed a fellowship in behavioral neurology from the University of Iowa. He has published over 400 papers and has a Google Scholar H index of 113. His research has been highly cited, and it focuses on understanding the neural processes behind human decision-making and choices. Along with Drs. Antonio Damasio and Hannah Damasio, Dr. Bechara studied decision-making of patients with injury to the prefrontal cortex, and it's really groundbreaking work on the neuroanatomy behind emotion and how emotion influences cognition. He has used what they have termed the somatic marker hypothesis to show the relationship between emotion, decision-making, and memory. And there is a link to one of these important articles that they've written on the somatic marker hypothesis in the show notes. So you can check that out for more information. Welcome to Dr. Bechara.
Thank you. Thank you.
Thank you so much for doing this. I wanted to first try to put you into a more humanized context and ask you if you could share something about yourself with me.
Well, the very first thing people ask me, where am I from? I say, I try at first to say I'm from Canada, or I say from the United States. But they say, no, where are you really from? I was born in Lebanon. And I came as a young person to Canada. So that's why I was educated in Canada. And then I moved to the United States. And I've been in the United States since 1991. So I'm a U.S. citizen as well. I spent many years at the University of Iowa Hospital and Clinics in the Department of Neurology. And now I moved completely to academia. I'm the chair of the Department of Psychology here at the University of Southern California. I also work closely still with my mentors, Antonio and Hannah Damasio, at the Brain and Creativity Institute.
Yes, very cool. One of the articles that I read of yours that first got me introduced to your work is the article that's in the show notes where you show that lesions in a stroke victim, someone who has had a stroke, they're perfectly functional, but they can't really make decisions well. Can you tell a little bit about that work?
People sometimes say, my gut feeling tells me that. Well, this is kind of, a lay term. What the somatic marker hypothesis, it's more of a neuroscientific theory that describes in neural steps how actually gut feeling really happens. So in other words, yes, we use our brain to solve a lot of logical problems, a lot of things, but many important decisions in real life, they're not certain. They're very uncertain. They're very ambiguous. And the way the brain cope with that is by relying on those, what we call body states or somatic states. So those signals guide us towards things that could be good for us or guide us towards things that could be bad for us. Patients who have brain damage that are deprived of that ability to sense their gut, if you want to say so, they make disadvantageous decisions. A lot of people give emotion a bad reputation. People always tell you emotion is bad for you, emotion clouds your mind, emotion interferes with your judgment. Emotion that comes from the outside. So let's say you're very, very angry or you're very, very sad. Something rattled you outside and you come to make an important decision. Emotion that is unrelated to what you're working can be disruptive. But the emotion that you evoke and you enact as a part of your decision, if you're deciding on where to move, what job to take, or if you're deciding on what stock to buy, that gut feeling that you may enact at that time, that's very important and very helpful. So I think we need to distinguish two different contexts of emotions. The context where emotion can be disruptive versus calmer emotion that's actually much more beneficial.
I think that makes sense to me you can correct me if I'm wrong, kind of like hunger,
Mm-hmm.
which hunger is a somatic state and in a way a true gut feeling, my stomach is empty and I feel that signal. So I can be hungry and it can be a true signal for me to eat, or I can be eating out of sort of emotional, like I'm an emotional
Yeah.
eater, like
Yeah.
I'm eating for external factors, whatever they
Yes.
are, and not really listening to my gut.
Yes.
So I guess
Yes.
that's what you're kind of saying. Okay.
Yes. Yes.
So we do have a true somatic
Yeah.
marker of our gut feeling, but oftentimes we're acting on our external other emotions that we have, which is often not advantageous. That outside sort of emotion that's like really high anger or something not being
Mm.
good for our decision making versus really listening to our somatic state.
Yeah.
Is that why mindfulness work helps?
Maybe. Yeah. From what I know, it's nothing other than training some of those areas. The ventromedial prefrontal cortex is one of them. Training those areas that we're talking about as part of the somatic marker circuitry, training them in that exercise. And then I wouldn't be surprised at all that it's a method for
Yeah.
helping or
Okay.
improving
Yeah.
the functioning of that
Okay.
circuitry.
Yeah. People who meditate,
Yeah.
they have actual major changes in their brain.
When you look at where are those changes, they're not everywhere. They're not in the visual cortex. They are in those areas that we describe as part of that circuitry that deal with emotion and with
Huh.
the limbic system. And
Yes. This whole body of work completely fascinates me because, as anyone who's been listening into this podcast knows, we were exploring emotional intelligence.
Mhm,
And then I also explored a little bit metacognition and
mhm.
system one and system two, that dual process theory of thinking. Emotional intelligence, there is quick emotions or just sort of quickly how we feel, which is sort of like, say, our gut feeling about something, type one sort of feeling. Until I read your article, I was definitely in the camp where I thought emotions cloud my judgment.
People always talk about cognitive intelligence and reasoning. Well, we tested patients who have a prefrontal cortex damage, and we ask whether their cognitive intelligence declined as a result of the damage or their emotional intelligence. And sure enough, their cognitive intelligence is not affected at all, but emotional intelligence goes down. So there you go. So there's another at least neural link between emotional intelligence and certain brain areas that is separate from cognitive intelligence.
Yes, that's fascinating. Before I started recording, you were telling me a story about neurology, and you were telling me about what happens when there's a small stroke, meaning just in terms of the actual area of brain that's damaged, small,
Mhm.
when it affects just that sensory portion versus the motor portion. You said there's a huge difference. And can you just tell a little bit about that?
People most of the time, they think behavior and everything goes inside the brain. The idea behind the somatic marker hypothesis is that no, the body is very important. This is an anatomical, neurological fact. In the brainstem, at the level of the pons, whoever knows neuroanatomy. So all the motor descending pathway travel in the front, all the ascending pathways, the sensory pathways coming from the body going towards the brain, they travel in the back. So strokes can happen in any one part. They're relatively rare, but they can happen. If they hit the motor systems, the body becomes completely paralyzed, but the person is still conscious. In a locked-in syndrome, the person looks like they are in a coma, but they are conscious. They hear you. They understand what you're saying. If they can move, they can only move their eyelids. They can blink. But if you hit the pathways in the back, the ascending pathway, that's when a person goes into coma. So if the brain gets shut down from its communication with the body, it stops functioning.
Yeah, when you told me that, I thought that was completely fascinating that the brain needs that sensory connection to be aware, to have consciousness.
This work, a lot of it, it's really about demonstrating that things that happen in the body, it's really impacting the brain. It's really impacting behavior. So imagine you're playing a game. You have to solve a puzzle, and then you know the outcome, and then they tell you you won or you lost. So there is a reaction. There's an emotional reaction to winning or losing. So that's no brainer. So you get a reaction. So if you win something or you lose something, I can get a reaction. The key is before, when you are thinking, when you are deliberating, thinking about what decision you want to make. That's what we were focusing on. What is the role of those responses in what you do behaviorally? So basically, in normal people, and we can show it across time physiologically, that over time, normal individual develop those anticipatory responses over time. That is, as they learn, it's as if their gut telling them stop. Patients who have frontal lobe damage, they don't develop those responses. They react to winning or losing. They have an emotional reaction to that. What if what if you cognitively know that these choices are good and these choices are bad? Do you still need those body signals? And the answer is yes,
Hmm.
because we describe instances of certain patients with frontal lobe damage who cognitively come to realize that some choices are worse than others because they're losing more money on those choices. In spite of that, they keep choosing disadvantageously. They keep going for the immediate high gain. There is a disconnect between what one knows. Some of them can become cognizant. They can have the cognition, they can have the knowledge, and yet still choose disadvantageously.
In that same article, you mentioned the word bias.
Yes.
And you use it in a particular way. 30% of those participants who were choosing advantageously for themselves, they didn't know why. You called that an unconscious bias
Mhm.
derived from experience with reward versus punishment.
Yes, because none of those somatic states, when we say gut feeling, you're not honestly feeling anything. And that's what those somatic states are, or gut feelings. They're not really the conscious feelings, but they are body states. But they happen. They happen as a result of experience. You try and you win and you lose. Your brain keeps a record of those experiences, but you're not conscious. You don't have a declarative memory of all of that. That's why when you are confronted with the decision, body states are based on prior experience.
Mm-hmm.
And then that's what plays a role in telling you we have zillions of emotional experiences. We have reward, we have a punishment, but we don't keep a declarative memory of every event. And that's what a gut feeling is. It's the way of the brain evoking subconsciously emotional state or body states that
Mm-hmm.
then they come and help tell you,
Yeah.
don't do this or do this.
Yeah. There are different definitions even of what an emotion is in psychology. And interestingly, for psychologists who do agree with the universal emotions of happiness, sadness, fear, disgust, anger, and then maybe a sixth surprise,
Mhm.
but some people don't. But say you have those universal emotions, those are actually encoded in our facial expressions, which are sort of largely subconscious to us. It's not like I deliberately arrange myself a certain way to look happy, right? It's just something my face does. And then, but also it's encoded in the body. There are other researchers have shown there are bodily states of high activation, low activation in different parts of your body that correspond in a somewhat universal manner across culture for many emotions, even beyond universal emotions. Do you agree with that research in terms of your somatic marker
Yeah.
hypothesis?
Emotion, it's something that you could see in a person, or at least you can measure, with some sophisticated instruments. What you see expressed in the body versus what the brain senses or subjectively experience. Emotion versus feeling.
Do you have any final thoughts?
Most people who do brain research take the brain as an organ by itself and as if behavior and everything can happen just in the brain. And what I would say, the brain is basically useless
Huh.
if it's not connected to the body and the body giving it information.
Thank you so much for spending time talking to me today. It was really fun for
Thank
me.
you. It was fun.